Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice, and if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Now, today's episode is brought to you by Chckup, but we're going to get to talking about them in just a little bit. We need to hammer home reviews.
Where's the hammer?
Dang it!
This every time.
John Wesley King, who is also now helping on the podcast. Can you please remember to bring Thor's hammer next week? Okay.
I mean,
excellent.
we're doing this theoretical hammer, so we got to make a sound.
All I know is if you guys see this, what do you have memories of?
Sounds
Harrison
like
and Johnny. Memories. Look at what I'm doing.
Laser tag?
They're not paying attention to you at all.
No, what is this? Yes, thank you very much. That was Trevor's go-to motion for charades on Thanksgiving.
Nice.
And it was for every word that he looked at. And we could
Every word?
Every word. We were like, you're throwing a ball. You're throwing a hammer. The first one, it was a boomerang, which was absolutely applicable. But then all the other ones after that, no. Nothing to do with this motion. So anyway.
It's like me in Pictionary.
Yeah.
I feel nothing.
So yes, write those reviews on Spotify.
Yep. Okay, how's everyone doing?
Great.
Yeah? Feeling good?
I'm a little tired. How's work been?
It's good. Yeah? Good. Feeling good? Mm-hmm.
Yeah, it's been a good week. Good recovery after
we just
Thanksgiving.
pulled 1,000 mils off of a 10-pound cat.
Nice.
And that wasn't even half of it.
Yikes.
To make it breathe better.
Mm-hmm.
Yep.
Because just to give it some more time with the owner.
Oh, that
well, it was in
nice.
his abdomen, but
yeah.
We did a chest tap on Tuesday on a cat. Mm-hmm. It was the same cat. No.
Different
We
cat?
haven't seen this cat since 2018. Okay.
Well, gosh.
Well,
those are
hopefully,
nice palliative techniques.
especially around the holidays. I feel like it's where it gets really hard.
Right? Don't you feel like
to
there's
say goodbye,
more?
More
euthanasias around the holidays?
Absolutely.
Oh.
Yeah.
We've probably had
Did you guys see the moon last night? That was the other
Yes.
thing that made me think
Yes.
of, wow.
I know.
It's like, get ready.
It's happening.
Buckle up.
I know.
There was a halo around it a few nights ago.
Yeah, it was very cool.
Was that
too.
very pretty? Like if you looked up at the moon, there was
No,
like
I know.
I looked it up and it said that snow or rain's coming.
Wait, what?
And then snow came.
Oh, when the
when there's
halo
a-
happens?
Yeah.
There's
What's
rain coming?
Rain?
It Rain or said
snow.
rain or snow is coming.
Oh,
That's
interesting.
like it snowed a little
and
bit.
then it rained on Sunday? Is that why?
I think I saw it Saturday night maybe, and then it snowed Monday. Right?
Sunday, Monday. Oh, Sunday.
I don't know
It did,
what day it
Monday
is.
it did sprinkle like a little bit of snow
Yeah,
showers.
it rained and
Sleet or
snowed.
whatever. No, not a lot of pancreatitis cases after Thanksgiving.
I know.
So
Maybe
far,
the
knock
PSA
on wood.
announcements
I
over
know,
all
I was
these
kinda
years have
surprised.
Yeah.
made a difference.
I mean, the week's not over yet. So.
I know, right?
Could be delayed. They're getting the leftovers.
Now, what we did forget to do, because we've been the same group on the podcast, but we should tell everybody who everybody is.
Oh.
Yeah, that
Just
sounds good.
So let's back up, rewind.
How about everyone says one nice thing about yourself? Self-positive talk.
Oh, wow.
Why don't
That's
you start
hard.
us off?
Okay, you start us off.
I
Duckwall.
am Dr. Ashlyn Duckwall, associate veterinarian here at All Star, and I am optimistic.
Okay. I like
That
it.
she is.
That she is. Okay.
He's got a little glance into her mornings when she's talking to herself in the mirror.
All
She
right.
hasn't worked
Today-
today.
That's right. There you go. Okay.
No, I try to be positive. Oh.
You are all day. I know you're positive. It's just we don't do
Wow.
self-affirmations every day.
I know. We should do it more.
Okay. Oh, I'm next.
Mhm.
I'm Devyn. I am her room assistant. And this morning I looked and I'm 12 weeks ahead in school.
Okay.
Nice.
Way to
So
go.
you're smart.
No, I am smart.
motivated.
Motivated. Okay. I like it.
I'm Courtney. And I'm caring. I think I'm caring.
You are very caring.
Yeah.
Mm-hmm.
That's a good word for you.
Thank you.
And I'm Emily King. And I would say, my word would be resilient.
I agree.
Nice.
Okay. There we go.
Wow,
Positive.
this sounds like I just screwed up and just said the wrong thing. Okay, fine.
Your word was great. I love
Okay,
it.
let's move on. Okay, Courtney, you're up for the next special.
Yeah, because you
event.
guys might be wondering why.
Yeah.
Well,
right?
if
Why
you're
we have-
watching, because some people listen.
Oh, that's true.
So if you're watching the podcast
Yeah.
right now, we have a whole display of beverages in front of us. And I came up with this idea because there's a trend going around on social media where you make veterinary-related or veterinary-themed drinks. So we all put ideas in whatever you in a bag, and we pulled them. And so we had to use our very creative minds and make them.
Yeah.
And so now we're going to guess what each of us made, and then we're going to taste them.
Yep.
Nice.
We're going to describe too, like what the word is that we pulled from the hat or the bag or whatever.
Yeah, because we don't know each other's words.
Yeah.
And then we guess what the word
And we put more words in there than we could pull out. So
Yes.
we really don't know.
Yeah. So if you're able to watch, this would be a fun part to watch.
Yeah.
So go to YouTube or wherever he does it at.
That's right. All right. Who's going first? Duckwall?
Okay.
It's going for dog wall.
So everyone would like to raise the one that I made. If you can see here. Yes. So if you can see here.
Are you telling us what it is?
No, not yet.
No, we got to guess her
Okay,
word.
that's
We're going to
what I
guess
thought.
her word. We're going to guess her word.
Okay.
So this may not smell like it does in real life. It smells opposite of what it would actually smell.
Okay.
In vet med. This has a thick brown consistency, watery, with a gelatinous.
Ooh, gelatinous keyword.
Gelatinous red coloring that is on the sides there.
I got
My
it.
stomach's churning.
There's also an additive red layer on top because that may come with it.
Okay.
I got it.
What do you see?
What do you think
guessing?
it is?
Parvo?
What do you think?
Ruptured anal gland?
I'd say colitis.
It's parvo.
Oh, nice. Okay.
Really the smell.
I
of
mean, I
parvo,
really
but
deal with the parvo the most probably.
Oh,
in this group,
yeah.
so.
It smells much better than parvo.
Oh, yeah.
I just can't. How can you replicate?
No, this is your
This was good.
description is what gave. I mean,
Okay,
That's
This is
good.
very good. And you can see,
but
you
now
can
that
see
like
the
how you
gelatinous stuff on the
describe
bottom.
how you
Look.
describe the consistency of it's a little gross to me out, but
yeah, the
Okay.
bottom of that there really is a good depiction of. It's the cherry juice that's settling.
Okay,
Wow.
it does
With
not taste
chocolate.
like parvo. Not that I know what that tastes like, but
I would hope it doesn't.
that's good.
yeah,
It's chocolatey.
Yeah,
Ooh, it's
well,
totally
a chocolate
chocolatey.
cherry.
And it's got like
Chocolate
different textures.
cherry.
It's crunchy. It's smooth.
I like it.
Sprinkled all
Ew,
over my
parvo
mouth.
is.
Okay, look.
Just
tip your
imagine
glass. Oh, you
parvo
can't tip your
bubbing.
glass down long enough.
Yeah.
Look, Duckwall, if you tip your glass, look at the bottom of it. Doesn't it totally look like
So that's cherry on the bottom?
like intestinal like like wall that comes
Lovely.
out?
Wait, is there cherry in here?
I mean, I knew that. Yeah, there's a cherry and then cherry juice is what's.
Oh my gosh, I
There's
love
cherry?
it.
I gotta get the cherry.
Very
I
clever.
need a toothpick.
That's really good. I like it.
Very clever. Very
That,
clever.
yeah,
Love it.
very smart. And your presentation was
Presentation
Wow.
amazing.
Okay, who's next?
Okay, Devyn.
Sure. I'll go. Okay.
Grab it.
Everybody left.
Oh, okay.
Mine's not as intricate, but it's just a little specimen jar
Specimen jar.
with some bloody liquid and a gummy eyeball floating in there.
there's floaters in mine. I think the eyeball's shedding. I think so too. That's just the tissue.
I love the eyeballs.
Oh,
Okay.
it makes it off-putting. The eyeballs. would be
The eyeball's
off-putting.
really creepy.
The floaters is what's
Yeah, there's the film on the eyeball, but it's edible. So.
Okay, what do you guess? What are you guys guessing?
Enucleation.
Ooh, enucleation.
Enucleation. Just because I remember we
Yeah.
put it in there.
Yeah.
Okay, it's enucleation.
Mhm.
Okay, very good. I like the blood.
What did you originally think? Did you think something different?
I don't know. I was thinking like some type of like traumatic event, like
Oh,
you know, because the blood,
yeah.
Yeah.
Mhm. Yeah.
There is a film.
like prop toast eyeball.
Don't
Yeah.
think about the film when you're drinking it.
Oh, fruity.
That's
Yeah,
really good.
Fruity.
Are we gonna eat the eyeball?
I like
can.
the juice.
I don't
flavor.
know. The
candy.
texture of the
But it takes a few
squishiness
minutes.
is going to really.
It takes a few minutes.
Is it going to throw you off?
I think it might.
Uh-oh, I can't.
It's
grab
just a
it.
gummy,
She's fishing
right?
it out. Yeah.
It's just a gummy. I don't know if I can eat it.
I don't know if I
I
can get
can't
it
grab
out.
it. I need a napkin.
I really
There's a
don't want to
napkin right
stick
there.
my
Oh, yeah.
finger.
Oh, she's. I don't think you can bite it.
Ah, you can't. You can't bite it.
Okay,
Did you put the whole thing in
I
your mouth?
really will.
She did it. She put the whole gummy.
It
over
has
it.
a. It has a film on the
Oh,
outside.
I'm not doing it.
not good.
Oh, that's
No.
awesome. That is awesome. I can't do it.
no.
It's there's a film on my teeth now.
No, no,
I'm
no.
gonna throw.
I don't know
Oh.
what brand that is. Don't buy those.
It's Amazon.
Oh no.
There's like I'm gonna throw up the film that got on my teeth.
I gotta
spit it
swallow it
out.
now.
That's awesome.
Wow, she really took one for the team for us. Thanks, King.
And there was like a cold like film.
Well, that fits with the nucleation.
Mine's just for appearance.
Woo!
It was tasted good. drink tasted really good.
The eyeball tastes good once you digest it too.
Okay. She begs to differ.
Oh my goodness.
Okay, it's Courtney up. We're going in a row.
Oh, sure.
Yeah.
Okay.
Ooh.
So cute.
Okay.
This is really good.
This is brilliant.
It gets
This
me.
is so gross.
This is so brilliant. I love it.
You have to really describe it in case people
Okay.
aren't watching.
So we have a red liquid here.
It's so gross.
There's no texture. It's just a normal consistency of liquid. And then on top, we have a garnish of a gummy worm. And then funny story. So I was running around at 9 p.m. at night trying to find candy, and nobody sells heart-shaped candy. So I cut the top of Sour Patch strawberries off that was green and just put the red part
That's
on.
hilarious.
That's
Oh my God.
And then on the inside of the glass
oh,
is
That's so
some
brilliant.
cooked spaghetti noodles.
Oh my God. It's so brilliant.
To
It
bring
looks
the
so
whole
good.
drink together, I think you have to eat one.
It falls in my mouth.
Oh.
this is why I can't eat spaghetti a lot of times because of how it looks when it's good.
Oh, wow. I'm telling you,
I'm
this is
scared.
really good.
Yeah.
Thank you.
Well done on the pasta.
Well
you.
done.
Yes.
Very well
I
done.
know that was the last minute. I was like, Jacob, I have to make pasta. And he's like, why?
You're
Yeah.
always
Yeah.
making
Genius.
This
I
is-
mean, it's very disgusting looking.
I love the glass though that they're clear. You can just see all the way
Yes.
through it.
Mhm.
That's key.
Perfect.
So
You have to
we all
just-
know what this one is because we
Yes.
work in the industry. If you're not on video, you got to see this because this is so uber
This
clever.
is what it looks like in your animal.
Yep.
Just
that's
saying.
that's pretty spot
That's
on.
encouraging.
That's exactly what
Yeah.
it looks like in the
Yeah.
So
heart.
this will scare the riddance out of you.
Mhm.
Just
Give
that some
better give that
trio.
prevention.
Get that
Mhm.
trio
Okay,
for
so
heart.
Courtney, what is it?
You didn't guess.
Oh, it's heartworm.
Worm.
No.
Heart, literally, this
yeah,
is what the
it's
worms look like
heartworm.
in
This
the
is
heart.
exactly
disease.
yep. Floating around
Think
in liquid.
about cooked spaghetti in red
Crawling
liquid.
through all the.
My candy's normal if you want to eat
Oh,
it.
yours is good.
It's not from Amazon. Is it?
Okay,
It's
I
good.
can honestly like looking at her worms and her drink from afar is so gross.
They're right in front of your face and your
I
drink.
know, but it's worse when it's like the magnifying.
Oh, yeah, it is
effect of the
magnified.
glass.
Ooh, they're wiggling in there.
They also. Look
I was
like
gonna have them
roundworms.
hanging out the side of the thing, but I was scared they're gonna fall out everywhere.
No,
Okay.
these gummies, not the eyeball.
Mhm.
Yeah, that's better than
Gummy
my
worms.
Okay. All right. My drink is a
Wait, hang on. Okay,
my
This looks
part of mine
fun.
sank in there. I tried to also because we're now into the Christmas holiday make it slightly festive, but
Nice.
it melted. So you have a white liquid that represents something, and then you in your syringe you have
Ugh.
which you can't see now very well because it melted around the thing. You have some
Look at
pink
it.
solution that you need to squirt into
Oh,
your
were those
white
syringes
liquid.
clean? Because I
Yes.
just licked the side of
Yes,
them.
ma'am, they're clean.
No, they're used. You got them out of the
Oh,
trash.
you have to squirt this in.
Squirt that in
Oh,
there.
you have to squirt it in there?
Will it
Yep.
overflow?
Stir it
Ooh,
around.
is it peppermint?
Oh,
and
You are so. This is so fun.
what do you guys think
I'm
it
having
is?
a good time. What's in the? Is that ice?
Yeah,
Oh,
there's
okay.
ice in there.
wow!
I'm having fun.
What do you think it is?
It looks like it just looks like pus to me.
Oh, wait. Yours.
But keyword, you said white and pink
Yes.
Euthazol
and
Propofol.
propofol.
Yes, ma'am. Euthazol propofol.
Yes.
Thank you.
Oh my gosh,
That
that's
is
such a good
phenomenal.
idea.
Euthanasia in a cup.
Euthanasia. Go.
Sorry.
There you go.
That looks like blood.
That peppermint.
Mm. Yep.
Wow, that was genius. I was thinking like I just kept thinking of the chyothorax. I know we have
Oh,
Mm.
yeah.
in there, which is basically pus liquid
Right.
Mm-hmm.
in a chest.
Yes.
So that's what I was thinking is that this was like, but that was genius.
Well, thank you.
Wow, you guys,
We're so creative.
It is so that was fun actually to do.
The peppermint's nice
We
that
need
was
to-
really fun.
We need to do it on a larger scale for more people at some point.
Everybody at the Christmas party.
We have enough things
Christmas
we could
party.
probably do it every episode for the next year.
Yeah.
We probably do. There we go.
Oh my gosh, that was so
That was
fun.
Okay, great job.
That was
Great
so
job.
fun.
Great job. Great job. All right, now let's hear a word from our sponsor,
Okay.
Chckup. Every day, software becomes more important to the lives of clinicians and their patients, but outdated and complicated software, combined with the rising standard of practice performance, makes it difficult to stay ahead and avoid burnout. That's where Chckup comes in. Chcukup's main focus is to help you manage your practice while you can focus on caring for pets. It's that simple. Did I mention they also save you time and money? They have all the features you'd ever need, from practice analytics to online scheduling to communications to reviews and more. One of our favorites is the scheduling feature, which seamlessly integrates into any PIMS. This also includes read and write. We've worked with many of these companies in the past, and I can confidently say that Chckup has one of the best online scheduling softwares I've ever seen. It's that good. By having 4 systems in one, Chckup is guaranteed to save you time and money to help you work on your business and not in your business. If you sign up for Chckup and mention the Veterinary Roundtable, you'll receive 50% off your setup fee, which is a value of $500. So be sure to sign up for Chckup and mention the Veterinary Roundtable to get that 50% off your setup fee. Thanks again to Chckup for sponsoring this episode of the Veterinary Roundtable. On to case collections.
We have Devyn and Courtney doing cases because
Sorry, I still have eyeballs stuck in my tooth.
that's so disgusting.
That's something you don't
Have
hear
you
every
ever
day.
seen? I mean, everyone's been there for a enucleation, right? Like, have you seen one?
No. But
You know, one of my
I
favorite.
love doing
you
enucleations.
know what my favorite thing in high
Oh.
school was in anatomy? Cutting open a cow eye. I loved that for some reason. The eye is so interesting to me.
Calvin
I
is
love
so
it.
excited because they're studying the eye and they're going to see a cow eye.
Yeah. Like
So
here, every time there's an enucleation, I ask if I can cut the eyeball open. I love it. I think it's so cool.
One of
Yeah.
the only times I've ever gotten nauseous through like, not as in my career, but like as a student, you know, learning and going to clinics was a horse enucleation. And obviously there's so much blood
Mm-hmm.
on the ground. It congealed and clotted and I had to clean it up. So
Ugh.
literally you can't just wash it down. You had to pick up the clots and throw it in the trash.
And then they slip
That's
through your
awful.
fingers.
It was so
that's
disgusting.
gelatinous.
That was
That's
gelatinous.
gelatinous.
Ew.
That I will never forget that experience.
Oh my goodness.
So, anyway, so they're going to do cases because the listener question is very extensive.
Is a case.
Yeah.
Yes. Okay.
You're up.
So
Okay.
start us off, Courtney.
I like my notes so I don't forget anything. Okay, so we have a 6-year-old golden retriever who is the bestest boy in the whole world. And he came in on October 6th for swollen and enlarged lymph nodes. They were his submandibular lymph nodes. All the other ones around his body were completely normal. So we started him on an antibiotic while we waited for some testing. So we sent out a tick-borne panel. We did a fine needle aspirate of the lymph nodes and sent out those samples. And then we also sent out blood work. Tick-borne panel was negative. I didn't look at, is that, okay, that's what I thought. Okay, so that was negative. But then the FNA results came back as, unfortunately, lymphoma, which is a type of cancer. And so the owners, we kind of talked to them and gave them all of their options and kind of what they could do moving forward. And after they discussed it with each other, they decided to pursue staging here at All-Star. So what that entails is you do chest x-rays and then you can move forward with the abdominal ultrasound just to make sure that the cancer has not metastasized, so it's not moved throughout the body. And on his chest x-rays, we did find metastasis, and he had enlargement of his mediastinal and sternal lymph nodes. And then the ultrasound showed involvement of his spleen, kidney, and GI lymph nodes. So that's kind of worst case scenario, unfortunately. So he kind of had spread all over the place. And so after we told the owners that information, they had to digest that. And then they actually opted to start chemotherapy here. And so he comes in weekly. He skipped 1 week, but then just that's how the protocol works. But he comes in weekly. We check CBCs, which is a complete blood count every week to make sure everything's still stable with his platelets, things like that. And he has had 4 treatments so far. He's only vomited, I think, once or twice, if that, after one of his treatments. And you would not think he had cancer. Like
So he's in remission.
No.
I can still feel the lymph nodes.
Yeah.
They're not completely gone.
Okay.
So
That's what I was going to say. They've shrunk.
yeah, they've shrunk.
Yeah.
Oh my gosh. So more than 50%.
Yeah, they were,
But-
what, like grapefruit or bigger? And
Yeah.
now they're
I wouldn't, not grapefruit. I would say,
maybe a little
Apple.
smaller. Yeah.
I don't know. It's grapefruit bigger? Yeah.
Plum.
Yeah.
Plum.
Whatever. I don't know.
Plums are small.
Yeah. But
Yeah.
no,
Yeah.
what I
I
was
could-
saying
I
is,
could
fit my
right there.
small
what I was
chance
saying
in.
is you wouldn't, like, he's just a really happy dog and his
Yeah.
lymph nodes have shrunk and he's just doing really well with the treatment. So it's just
How
cool
old
to
was
see.
he again?
He's 6, almost
6.
7.
Okay, not very old. Yeah.
We love
Yeah.
him.
They did adopt him as an adult, so he could be older.
Oh,
but
yeah.
So I consulted with an oncologist as well about his findings because
Mhm.
she also gave us the protocol. And unfortunately, with all the involvement of lymph nodes everywhere and the GI and everything, it put him at stage 5 out of 5.
Yeah.
So the prognosis goes down quite a bit when you go to that stage. It's the last stage, but thankfully he's been tolerating everything
Yeah.
really well. And these owners are fantastic and they just want him to be happy and healthy. And happy
Yeah.
with what he's dealing with. So
He's very happy. That's what I was saying. Like, you wouldn't think he's just such a happy dog, and he's tolerating everything really, really well.
and
Yay.
lymphoma is one of the unique cancers. I think that we can facilitate chemo here.
Mhm.
But there are, the majority of other ones we just unfortunately cannot. So.
And it's one that if you can get a response, they seem to do really well. And I think there's a myth that dogs don't tolerate. It's like people with chemotherapeutics, and they just do great with them.
Yeah.
I mean, really, from a clinical sign perspective, we're really just, their bone marrow is probably the thing that we would most often see affected. But they've done so much research with this particular protocol that they're really good in terms of the dosing regimens. And so I think I've only had one case in 20 something years where I've had a neutropenic dog secondary to treatment.
Nice.
And so I've just been so impressed with how the dogs do when you're treating them. You know,
So I'm saying he just had animals are resilient.
The
Yeah.
other
Like
thing
Dr.
with
King.
with lymphoma too, you can figure out if it's B or T cell because there's different prognosis. T is terrible, B is bad. So you don't want to have T cell lymphoma because that prognosis changes a lot.
Yeah.
But they opted to not do that testing because it didn't really matter. And then likewise, like when we found changes in the abdomen, you can sample it and confirm it's lymphoma, but it doesn't change anything. You're still going to do the protocol. So that's just other things that owners may come across as decisions to decide if they go to an oncologist or how much information they would want to know. There is more to get. It's not always necessary.
Right.
So
Oh, yay.
Very cool. That's great.
Oh,
We have
boy.
We have two chopped dogs, don't we now?
Yeah.
We do.
at the same
Yeah.
time.
At the same time.
One comes in on Tuesdays, one comes in on Fridays.
So interesting. Yeah.
We haven't had one in a long time.
Right.
Very long time.
Very cool.
Okay, I'm up. So I'm going to use my own doggie. Her name's Mitzi. She is a going on 15-year-old Pomeranian. Last year, she had a bout of PUPD. So we did some blood work, diagnosed her with kidney disease. Long story short, we ended up doing an abdominal ultrasound, and she also has a liver mass. So we started her on telmisartan, Denamarin, and now she's on phosphine powder, and she's pretty controlled, thanks to Dr. Duckwall. But with her old age, and she's always been a farm dog, but she has pretty bad arthritis. And when this new Librela came out, Dr. Duckwall was like, we should do it on her. She's like the perfect candidate for it because she has kidney and liver issues. So I gave her the first shot, actually a month ago exactly. And I would say after 2 weeks, she stopped hesitating as much to go up steps and stuff. And then since even in the past 2 weeks, she has probably gotten better every single day. And she feels so good. She actually got the zoomies the other night for the first time in years. I sent them a video. One time I was videoing something outside, and in the bottom frame, you just see her running by. She's just living her best life.
Funny.
And she feels so good.
That's
She's
so
so much
cute.
happier. She greets me and she does her little dance. Yeah, it's great.
That's awesome.
And that's only after the first shot.
Yeah.
That's great.
So
My dog's the
Librela.
same too. He hasn't had the second one yet, but as it went on, he is running out in the back with the younger dog. And
yeah.
so just seeing the improvement, it's really nice.
And I haven't seen it wean off. If anything, she just keeps getting better.
Yeah.
So
That's great. So
love that stuff.
give that second shot.
Oh, yeah.
right? Yeah.
Oh,
That's
yeah.
awesome. Very, very cool. Those are good cases, you guys.
Okay.
Okay.
How are we going to go through all this?
Okay. So
Read.
the reason Duckwall mentioned, we're not sharing cases today because our listener question is a case. And so why don't we,
That one time we went back and forth reading paragraphs.
share.
that
We
cat
can do
one.
that.
Let's
mean,
do
we're
that.
Reading? Yeah.
I think we should just go around
Let's just go down the story.
paragraph.
Yep. And just circle.
Yep.
Okay.
Just like we were in elementary school.
Yeah. Reading in a book. Okay. That works. I like it.
Okay, I'll start us off.
Okay.
Hello, vets. I came across your content on TikTok a while back and have since followed it over to other platforms and binged almost all of your podcast episodes. Thank you very much.
Thank you. Thank you. Yes.
I just finished watching the episode where you discussed Sam's dog Jax being diagnosed with Cushing's.
I apologize for the long post, but I am in desperate need of some advice. I currently have my boy scheduled on the 20th of November for some x-rays, an abdominal ultrasound, and have a blood clotting test. I'm sure you likely won't get to this before this appointment, but I would love to have some other thoughts, opinions, and suggestions from your perspective.
Some backstory on my boy Bruiser. He is a 6-year and 9-month-old pit bull Staffordshire Rottweiler mix. I adopted him Oh my goodness. I adopted him in September 2018 from one of my local shelters. He was severely underweight, weighing in at approximately 34 pounds. It was just being passed up by other potential adopters due to his kennel aggression. Honestly, he was just terrified and didn't have a mean bone in his body. Once I got him out and visited with him, he was putty in my hands and has been the best $25 I've ever spent.
Towards the end of 2020, he was close to 70 pounds, severely overweight, and had difficulty getting around. When then family vet diagnosed him with hypothyroidism and put him on some levothyroxine. He started to lose weight and was looking fabulous. Well, the weight loss began to be too much, and upon return to our vet, they said that his thyroid wasn't the issue and that they thought it may be diabetes due to all of a sudden increase in water and urination. We did glucose curves and some other blood work with no signs of diabetes. After that, he was tested for diabetes insipidus, had extensive blood work done, urinalysis, and abdominal ultrasound in early 2021, none of which gave us any answers.
Fast forward to October of 2021, we moved and started seeing a different vet. By this time, he started having bilateral hair loss on his sides, thinning of the skin, calcification of the skin in those areas, and developed a potbelly. Upon meeting her and looking at him for 5 minutes, she said that she was confident Bruiser had Cushing's disease. After doing a low dex test and about 8 months of misdiagnosing, we had a diagnosis.
Since then, I've had zero luck getting him to gain any weight back. In fact, he is losing weight, and he doesn't have much more to lose before I lose him completely. He has no muscle definition left. I've had him on high-calorie supplements, wet food, puppy food, salmon oil, etc. Nothing is working.
After months of trying to find an IM specialist that had availability, I finally got in at one of the clinics at MSU on the 13th of next month.
We had an appointment at our family vet 11/3/2023 for a checkup to get his meds refilled, blood work, and urinalysis. At the appointment, my boy yelped while having his blood drawn. He has never done that. Now his leg is severely bruised, and he has never bruised before. The tech did the draw perfectly from the cephalic vein, and he didn't flinch while I held him. I worked a short time in the vet med field, so they have me hold off or restrain my pets, and we have never had any issues. Even yesterday, he was perfect, but for whatever reason, he yelped.
The doctor yesterday said his blood work and UA looked normal. She also mentioned that she doesn't know if going to the specialist at MSU would be worth it because likely whatever the underlying issue is may be too far progressed to be able to give him more time. She suggested we take into consideration his quality of life and make the tough decision to help him across the Rainbow Bridge.
Here is where I need help. Obviously, I will know when it's time for him. However, I do not think that is after the 2023 holidays. We will be taking him for the ACTH test after this upcoming appointment with our family vet to check for Addison's. If they do not do it at his appointment next week, then he will have his IM specialist appointment in mid-December. He has always been a laid-back and lazy dog, more so after his buddy, my boy Rudy, passed last June, but not enough to cause concern. His behavior isn't causing me much concern. The only thing I have noticed is that he's a little slower to get up and doesn't jump at the word outside like he used to. He still gets froggy with my 2 pit bull pups, but is perfectly content laying around on the comfy furniture in the sunshine and getting belly rubs. He still has increased thirst and urination, but is now having bouts of incontinence both in his crate and in the house. This hasn't been an issue since I adopted him in 2018.
What more can I have him checked for? He is currently on 30 milligrams of trilostane BID and 8 milligrams of Apoquil SID. Please, 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 any and all help is greatly appreciated. If I'm just prolonging the inevitable, then I will stick to making an appointment after the holidays and help him cross the Rainbow Bridge. But if he has the chance to see another summer and go camping, then I want to give him that.
I've attached his current blood work too. Thank you in advance for reading this.
No, he does not weigh 55 pounds. His weight yesterday was 30.4 pounds, and back in March, he was 36 pounds. I'm so sorry for the long email and really do appreciate you taking the time to read it. I hope you guys have a fantastic day. Keep up all the amazing work. Thanks, Ashley Behle.
Okay. So,
I don't know. I mean, we do have pictures. I guess I'm not quite sure how that will get translated to the podcast, but essentially it's a timeline of what she described in his weight. So
correct. Yeah. Like visual pictures of his weight.
Yep. So lean, overweight, and then just kind of can appreciate that. And then you can start to kind of see the weight loss, muscle loss, hair loss as it kind of follows that timeline there. So
now I think that we should say, like we always do.
Yes.
And when we're in this situation, that the dog's not in front of us.
Yes.
Mm-hmm.
So, I mean, we can do our best to help out, but I mean, ultimately it can be very difficult to figure out exactly what's going on with them. So she's taking the right approach from the standpoint of making sure like she's getting him retested and going back and seeing someone in internal medicine at Michigan State. I mean, all that's going to more than likely you'll get to the bottom, of what's going on.
And I think we can speak to a lot of what we know he has, right? Or the treatment for hypothyroidism, what we usually see with that. Like those are the things we can address and try to correlate with what she's described to us. But it's very hard when you literally cannot even put your hands on an animal because there could be things on physical exam that
point you one direction or another.
Yeah.
Okay. So where do you want to start, Duckwall?
Let's just start from where the problem started. So I think it just starts with weight loss, right? Well, he was overweight. So that is a problem in animals. Them being overweight, especially when you kind of have to talk through their history. Was there a diet change? How much are they feeding him? How many treats is he actually getting? Things like that, because there's unintentional weight gain. There's you're doing it without knowing it, weight gain. There's metabolic weight gain, things like that. So I think seeing that he literally started off lean and then gained that much weight, that's maybe why they landed on hypothyroidism.
And I would say that we're assuming that he had some additional tests besides a total T4.
Yes.
To say that he was truly hypothyroid.
Along with his clinical signs, other than weight loss.
With his clinical signs. Yeah. The thing that kind of just jumped out at me is that on November 3rd, they said that his labs were normal. The doctor yesterday said his blood work and UA looked normal. We don't have the urinalysis, but if he's drinking that much that he's incontinent, he can't have a normal urinalysis. He has to have the urine specific gravity has to be lower than what would be normal.
Right.
So we're missing that piece of information, but also he does have an elevated alk phos compared to what he was in February of 2023. I know it's minor, but I mean, it's still a change.
I've seen very minor elevations, and you go looking, you find things.
Especially because of his PUPD.
Yeah, exactly.
Did they say in here that he had a normal ultrasound?
I was just going to say, has he ever had an abdominal ultrasound? Because I don't think it said
in early of 2021.
Did it? Yeah.
In early 2021.
It's right
none
here
of
in
which
this
gave
paragraph.
us any answers. I mean, this size dog, for them to have Cushing's disease, they typically would have an adrenal tumor, which would explain his lack of response to trilostane.
Right. That's what I was thinking. Like, if he had an ultrasound, well, she said this is where it gets kind of muddy too. They did blood glucose curves. You can tell you diagnosed diabetes from the blood work, which he had and a UA, right? So I'm not quite sure where
he shouldn't have been getting curves.
Right.
So that, again, that can be lost in translation. Yeah. There's a lot of information maybe we're missing.
And his labs are normal here. His glucose is 102. So that's normal.
Right.
Maybe we should talk about what you do when you have somebody that has PUPD. How do you work them up?
Yeah. Because I think that's where it started after they started the hypothyroid meds, right? So, well, first off, I guess I would want to know, is he controlled on the hypothyroid meds? That's a huge thing. If he's being overdosed on the hypothyroid meds, you're going to have rapid weight loss.
Because you make them hyperthyroid.
Yes. And you can have increased drinking and peeing as well. We've seen that with one of our cases.
Saw that, yeah.
So that would be my first thing. Was there follow-up to make sure he's on the right dose? And
did they discontinue it once they knew that
it
wasn't his thyroid?
Yes. And yeah, I think that's a huge thing. So then the PUPD, just like she stated, you start looking for obvious things that will cause that. So on our list, what are some things we'd have on our list for increased drinking and peeing?
Diabetes.
Cushing's.
Kidneys.
Addison's, which she mentions.
Addison's, which is low cortisol, which is opposite of Cushing's. Liver disease.
Kidney disease.
I said that.
Oh, you said that. Sorry.
She states diabetes insipidus. So that one,
so rare.
It's so rare, and it's kind of one of those last diagnoses you go to try to diagnose. It's like not of exclusion because you can do tests for it, but
it's like very far on the list.
Yes.
Infectious agents like lepto.
I was just gonna say lepto. Yep.
And then psychogenic.
Lyme, psychogenic. So yeah.
Okay. So extensive lab work.
Wow.
The one, and it says after doing a low dose DEX test, they had the diagnosis. So they diagnosed him with Cushing's disease, but the low-dose DEX test to distinguish between adrenal and pituitary.
That's the one that you can do.
Right.
Yes. So that one.
We don't have that piece of information. Like we don't see the test, I guess,
Right.
to say, okay, yeah, it's pituitary.
So I think we should talk about that, the differences between the two.
Okay.
So the low-dose DEX, yes, gives you a diagnosis of Cushing's. It tells you whether or not they respond.
In what? How many? 80% of the cases? I can't remember what the percent is.
It's sure.
It's high.
It's very high. So you have your two types of Cushing's. You have the one where it's basically pituitary dependent. So there's like microscopic overgrowth of cells in the pituitary gland. And what happens is that checks and balances and that signaling in the body gets crazy because there's extra signaling from the pituitary gland in the brain, and they're overproducing cortisol that way. So that's the most common one. That's your 80% or more, whatever the percentage is. Now, the other percent, though, is an adrenal-based Cushing's, where there's an adrenal mass on an adrenal gland in the abdomen. That one can operate differently in the sense that there's different hormones that get out of whack, to put it simply.
Yep.
So this test that she did to diagnose it should have been able to say which Cushing's it was.
Unless it gave her an inconclusive.
Yes.
Like, right? In which case, then she would have to do a high-dose DEX suppression.
Or an ultrasound.
Or an ultrasound. And
they said the ultrasound was normal.
they said they did an ultrasound, but
Or didn't give us answers.
adrenal glands can be hard to find. So like if it was
Right.
a general practitioner, I mean, like, I don't know, if it was a radiologist, then it's like, okay, yeah,
Right.
for sure.
And also, does normal mean like it fits with Cushing's? Because you're going to have changes on an ultrasound with Cushing's. Your liver is going to look big. Your adrenal glands will look different, even if there's no mass there. So I don't understand that part of it either.
Right.
Where she said it was normal.
Okay, so then they are going to go to the specialist in December, but they went back in on 11/3, right?
And to get to
Oh, but he's also scheduled on the 20th of November for some x-rays and an abdominal ultrasound and a blood clotting test.
So it
Which
sounds
she
like
just had done.
So it sounds
that
like
just got finished. We don't have the results of that.
Okay, so he was diagnosed with Cushing's, assuming he started meds, right? And then
Yes.
he kept losing weight. That's
Yes.
where we're at.
Yes.
So I would need to know too is, did they recheck the dose of the Cushing's? You have to do it within 7 to 10 days of starting treatment.
Yes.
He's gonna have to
And
adjust
you're
the
using
dose.
that to just tell you if you're overdosing him.
Or
Correct.
underdosing, yeah.
We hardly ever make a dose change at that time.
Yes.
Okay, so
I think that's where she said, though, we had an appointment for a checkup to get his meds refilled on 11/3.
Yeah.
And he was diagnosed in October. Okay.
okay.
So that makes sense.
And then she went into how bruised
that's-
he got and how painful
Yes.
it was.
But you can have issues with Cushing's disease and clotting.
Right.
That's one of the hypercoagulability, whatever, something conditions. Like,
Yep.
I didn't know that.
it's like one of very few, because people always like, a dog had a stroke. And you're like, well, no, it's not really a stroke. Like, dogs don't have strokes except for when there's like two conditions. Cushing's one of them.
That's, yeah.
But I don't know I can't remember the other one. But
Yeah. Or it's a weird paraneoplastic thing.
that's what I'm worried about.
If he has, so paraneoplastic means a secondary effect, essentially inflammatory effect from cancer. That's affecting something else in the body. So the cancer is affecting his clotting ability.
Right. And
Could
then
be.
it's also would be weight loss secondary to cancer. So because they're hypermetabolic or they're just chewing through so many calories.
Yeah.
So they can't maintain their weight. So then even though he's eating, he just keeps dropping weight.
Yeah.
The stem test that she talked about doing, that'll rule out Addison's. That's very easy to rule out.
Yep.
And that's how they would recheck his dosage.
I mean, the other thing too is like the bruising on the leg. I mean, Courtney and Devyn
Yeah.
can speak to this if you want to on blood draws, right? Even if a dog sits still, they move. I mean,
Yeah.
how often
Yeah.
we see bruising a lot, right?
Well, I was
Yes,
going to
very
say, I'm
frequently.
doing a blood glucose curve today, and I poked the dog once, and she bruised.
Yeah.
Like,
Yeah.
and I mean, it was a good stick, but bruising happens.
Yeah.
So it may be related
But
to
there's
disease, it may
also-
not.
Right.
Did you see the picture of the bruise?
Yeah.
Yeah, it's quite large.
But I mean, it happens.
Yeah. I mean, hematomas can
Bruising
form.
is normal.
Mm-hmm. for blood
If
draw.
he has underlying liver disease and that's what's causing the increased thirst, increased urination, and oh, by the way, he just has Cushing's disease, and the Cushing's isn't really the problem,
That's true.
then, I mean, that could...
Because clotting
he's-
factors are produced in the liver.
Right.
So that's another thing where on ultrasound, even if a liver, right, we were taught, even if the liver looks, if it looks one way or the other, you can't make a definitive diagnosis without sampling the liver. Like you have to poke it.
Yeah. And then they could do a liver function test like a bile acids.
Right.
But I think that he has something progressive going on. And so that's why his veterinarian is like, hey, I don't know if this is worth, continuing to put him through test after test after test,
Right.
because in the end, is it going to make a difference? But for you, Ashley, it sounds like you want an answer.
And she sounds like she'll do whatever it takes.
And so even CTing him, which
Mhm.
is not something they talked about, but that would be a way of like ruling out any type of invasive mass or tumor somewhere, possibly.
Yeah.
Um,
If she wanted to sample the liver, I mean, they're going to need to make sure he's able to clot before sampling.
Mhm.
So you don't want to do harm
Mhm.
by trying to get answers, right?
Mhm.
And
So I wonder how that clotting test went.
I guess the other
they
thing
did
too
it.
is like all the time we see Cushing's a lot, right?
yes.
So when you get them under control, they're on the right dose. I don't see weight loss. You just don't, especially to this degree. So it doesn't make sense for that Cushing's to be correlating with his weight.
His weight.
Mhm.
I agree.
Like the picture's extreme.
Yeah.
So
Mhm.
Yeah, I agree. I think that he has some other process causing
yeah.
weight loss, unfortunately. But I mean, I think I commend your commitment to him. I think that depending on what you found on the 20th, you might already have answers,
Mhm. Right.
and let us know what.
Yeah,
I know.
For sure. And she has an appointment mid-December with the IM specialist.
Yeah.
I think.
At MSU.
Mm-hmm.
Which again, I think that's always beneficial. Like even to just go and ask them questions or lay his case out and just like this, be like,
Mhm.
okay, tell me your thoughts. Like, is there anything that you would recommend we
Yeah.
should do, or do we just let it lie and keep him happy?
Mhm. Bring all the
Yeah.
statistics.
That's what they're there for.
urine. Mhm.
Yeah.
Yeah. Well, we wish you the best of luck. And
Yeah.
I commend you you did a great job like documenting historically,
Yes.
because it was
Mhm.
very easy to understand the progression of what you've been having to manage. And I'm so sorry that you're having to deal with it, and that there's often times where we would do anything to fix them, but sometimes you can't.
Right.
Mhm.
And that's a really hard boat to be in, when you would do anything. If you could just do something, you would do it. And sometimes there are situations where there's nothing to do,
Mhm.
unfortunately. But he's very lucky to have you, and thank you for taking such good care of him.
Yeah, thank you.
He's
for
really
advocating
handsome.
for him.
Yeah, he's very handsome. That's
Yes.
right. Absolutely.
We appreciate your love for him.
And thank you for the question and all
Yes.
the support. We really
Yes.
appreciate it.
Let us know.
Good luck, Bruiser.
Yeah, keep us posted, please.
Okay. I think that's all we got. Anyone else?
I think that's it.
I think we should give ourselves a pat on the back for our game that we did.
Should we vote a winner?
Oh, I don't
Oh.
What
know.
does that mean to do?
I think everyone did a really good job at representing their word.
Yeah, I think
I don't know how you would.
Yeah,
That's pretty
I
good.
agree.
Yeah.
we were
It's
very
pretty legit.
creative.
Harrison was even impressed. He's on the sidelines. He was like, wow.
Mm-hmm.
You guys were really committed.
Yeah.
Yes, we
Don't
were.
underestimate us.
That's
We get a
right.
challenge. We go above and beyond.
You know what I would love to see? Someone who is not in veterinary medicine or like has very little knowledge guess what these are. I think that'd be more fun.
Well, I can tell you when
Ooh.
I gave it to Charles, my husband, he had no clue.
He had no
Yeah.
clue.
Yeah.
Yeah.
about
He had
Jacob?
no idea. It was
hilarious.
Jacob knew what it
terrible
was.
diarrhea.
Well, he didn't get the heart part. He got the worm part.
You got the word part. Okay.
I mean, it's still worms. Like I was like, yeah.
I like it. Okay. All righty. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember to send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
Thanks, everybody.